resolution to adopt a Board of Health regulation to prevent the spread of COVID-19 in the county. Vaccination requirements to enter bars, restaurants, recreation centers, and other covered establishments. The lead sponsor is myself at the request of the county executive. This, for our public, and I know there are many tuned in, apparently, watching through YouTube today, who I know are very interested in this topic. I'll remind the public we will have a formal work session and invite key stakeholders, particularly in our private sector, who will be the most responsible for carrying out this public health order, to ask questions of them and discuss the operational impacts and see what, if anything, can be done to amend the order to reflect the change that's needed. I'll also just note a couple of things on the front end. This obviously follows what several cities around the country have moved forward, and several cities around the world, otherwise known as the vaccine passport, the most high profile of which is in New York City, and the District of Columbia is enacting their own version of it on the 15th. But we, as we always do, will be cautious and ensure that what's best for other cities still works here in Montgomery County, recognizing the stark differences between cities and counties that are urban, suburban, and rural, and have their own unique elements. So we look forward to this discussion. I know several of my colleagues have formally submitted questions of our colleagues in the executive branch, including myself. I hope that you'll be in a position to answer at least some of them today, but hopefully in a better position as we move forward with the ongoing discussion as well. So with that, Ms. Wellens, I'm going to turn it over to you to just briefly describe the order for my colleagues to set the context with more specifics. And then I will ask Dr. Stoddard or Dr. Kroll or whomever or Dr. Bridgers from the team to make some comments on behalf of the executive branch. And then I will call on colleagues in the order that you all text me. Councilmember Friedson will be first up. He has already texted. So with that, Ms. Wellens.
Thank you very much, Mr. President. And just to note that in addition to the work session where stakeholders will participate next week on the 18th, in addition to that, the public hearing is also scheduled to occur that same day. This resolution, as you said, it's similar to some other jurisdictions in the District of Columbia in particular, would adopt a Board of Health regulation that would require certain businesses and organizations to require that individuals entering them provide proof of vaccination in order to do so, and specifically restaurants, bars, fitness centers would be covered, gyms would be covered. A number of facilities would be specifically exempt from the requirement, including healthcare facilities, including grocery stores, including including libraries, including facilities where individuals are accessing essential services and essential services from the government. Those buildings would be exempt. In addition, certain individuals would be exempt from the requirement. That exemption would be twofold. First, if the individual is entering for a very limited short purpose, such as picking up takeout from a restaurant. And then in addition, individuals who are entitled to medical or religious accommodations would be exempt from the requirement as well. The resolution would take a phased in approach, meaning that as currently drafted, January 22nd would be the first date at which individuals entering the covered facilities would have to provide proof of one dose of a COVID vaccination for individuals 12 years and older. Then effective February 15th, an individual would have to show proof of full vaccination, meaning, the 1 dose of Johnson & Johnson or the 2 doses of the other vaccinations. This would not include the boosters. And then effective March 1 is when the regulation would take full effect, and all patrons who are 5 years and 1 month old or older would be required to provide the proof of vaccination. And I would just note, Mr. President, that I think part of the work session, it will be important, among other issues, to make sure that we really clarify which organizations are covered, which organizations are not covered by the scope of this order. We have had some questions from municipalities already asking for clarification. So again, obviously, I'll be discussing a number of issues, but just wanted to note that. Thank you very much.
Thank you. Turn it over to the public health team, whoever would like to begin to give some comments or background.
I'm happy to start. Oh, go, Dr. Burge. You go ahead. You missed this question earlier. You get to go. Go ahead.
Yeah, no, we can share the wealth, as they say, in looking at this vaccine passport, if you will. We've had multiple discussions even prior to leading up to the submission, and we've had done extensive research and looking at those other municipalities where we see the efficacy of a vaccine passport. We know that individuals travel either inter-county, interstate, internationally, and there may be instances where individuals are asymptomatic. And identifying those individuals who actually can demonstrate that they've been vaccinating and creating a safe place, if you will, outside of testing every patron who comes into one of those establishments as enumerated in the proposed legislation. Those individuals would be able to now present evidence that they've had some form of vaccination. And we know that some form of vaccination can begin to increase the body's response to any other variants. And if there are any other variants that are forthcoming, or variants of concerns, or variants that are emerging. So this is some of the background information that we put in time to craft this proposal, to look at creating safe spaces where individuals can, even if there's a mask mandate or not a mask mandate, to be able to enjoy those establishments and in a safe environment. So that's some of the background data. It started when Dr. Gales was here, and we continue to do the research. We looked at peer-reviewed journals to look at the efficacy and the importance or use or utility of vaccine passports. So I just wanted to share those comments this morning.
Yeah, the only thing I'll add, and this is just 30 seconds, it was drafted when originally Dr. Gales was here. We didn't do several meetings with businesses at that time to discuss with them. And largely the feedback we received was it was newly enacted in New York City. It was something we thought was a good idea, but we didn't have great information about how it was going to work in New York and other places. Since then, obviously, we've had a number of cities come on board, all within the last sort of 3 weeks or so: Boston, Chicago, Philadelphia, and most recently DC. And obviously, once we had a large regional neighbor who was enacting a similar policy, we thought it made sense to move forward with something that we thought had been a good idea for a long time. And so obviously, with the alignment of those things, the district coming on board, as Ms. Wellens clearly noted, we have clearly paralleled the district's order for regional consistency, as we've all sought to do throughout the pandemic where possible. And so I think that sort of gives you the background on what the intent and background on the development of the proposed Board of Health regulation. I would also note that Ms. Kinch is here, and she helped obviously draft this and has been looking at the way that it's been enacted in other places, and sure will be able to help describe hopefully some of the who qualifies and who doesn't based on the language used, how DC is interpreted, and how New York and other places have interpreted as well.
Thank you for that background and context. I just have a couple of comments and then a couple of questions. So I guess the first comment is, now private businesses can do this now, right? They can require a vaccination mandate in order to be able to enter their private business, irregardless of whether or not we pass this order. Is that correct?
Yes, some have done it. There are a number of feeders, AFI and others in Silver Spring, that do it. There are a number of restaurants in the county. The Chef Andreas owned restaurants all do it, I believe, across all of his operated facilities. Hank Needles in Rockville also does it. There are a number of that have already privately enacted.
Got it. And a sit-down restaurant is one thing where you're at a location for an elongated period of time. You're interacting with the waiter or waitress one-on-one. But do we have any information on how this has worked with fast casual restaurants or places of business that have high volume? And how do we have any information on how that has worked?
Yeah, I certainly will, if Ms. Kinch has some additions here. So the way it generally would work is obviously you come into a fast food establishment, you at the register, you say dine in, dine out, right? And if you are going to dine in, that's when they would ask you for a proof of vaccination. But if you wanted to just take out or leave the restaurant, you wouldn't have to provide that proof. Now, obviously, there are people who may say, I'm going dining out, and then they go and sit down. Where, the way we have viewed this, and certainly, we could add clarifying language on this, is that if the restaurant makes a good faith effort to ensure that the person is vaccinated by asking them a question, there wouldn't be a risk of a penalty if someone then provided incorrect or misleading information that led them to believe they were leaving the restaurant. Ms. Kinch, I don't know if you have additional.
What I would say, thank you for your question, Council President, Mr. Albornoz. What I would say is that in New York City, just like our proposed order, as well as in DC, fast food establishments, cafes, those kinds of places are exempt from this type of requirement. Of course, when you have a facility that, for instance, let's say a fast food restaurant where a person is going to go in, get their food and leave versus stay for a long period of time, could pose issues. But New York, at least, appears to have some good examples of how to deal with those situations, and they did not appear to really encumber a lot of trouble enforcing this.
And then I guess I'm stating the obvious here, but we acknowledged in the previous update that 2 dosages now is basically an expired vaccine passport, kind of going into this. And if we are going to ensure the efficacy of this initiative, it would likely have to include boosters. Yet, I think it's last check, this was Friday, I can't remember what the exact number is of people who have actually been boosted. We need that number to go up for sure, but the number is significantly lower than people that have received both dosages of vaccination. So it is, I'm not going to take a stance on that right now. I'll just point out again the obvious, that if we're going to do this, and it is a big if, I mean, there are a lot of questions that we have to sort through here on logistics and all of it, then that is something we're going to have to note. Otherwise, this is just a symbolic gesture at best, and not one that actually has true public health validity or efficacy. I do have one final question before turning it over to colleagues, and I see several other colleagues. I'll announce the order when I turn it over to Councilmember Friedson in a minute. But has there been a track of, has this, can we definitively say that these orders that were enacted in New York and the other cities, it sounds like, have enacted them more recently, but have they worked? The spread issues are significant. I mean, one potential data point is the number of restaurant employees that have gotten sick. That could be a data point that we may point to, because they are certainly on the front lines and being deeply impacted by all of this themselves. But do we have any data or information on whether this actually works?
So there's a couple of different ways to look at how things work. And I think Ms. Wellens, even in the council packet, I assume it was Ms. Wellens who read the council packet, did note that in New York City, they saw a 9% increase in vaccination in the weeks following, above what they would expect. So obviously, if your point is well taken, that if you're looking to encourage boosters, inclusion of them would certainly encourage more people to go out and get them to continue to be able to do things that obviously it would be to their benefit. Now, I'll have to go back. There were a number of data points that were looked at. We certainly can provide those about the actual impacts that they saw in their data for restaurant infections or contact tracing tying to restaurants. We can certainly provide that. I do believe they saw a reduction, but I don't want to just comment anecdotally based on things I haven't looked at in certainly many weeks. But I would be happy to pull up. We can ask the FP team to pull that data and provide it to the council.
And just to add, Council President Albornoz, and looking at the data, although the Maryland Department of Health contact COVID link has been updated since the 1st of January, restaurant and places of business as such still continue to be the top 5 places where we're seeing exposure. And so as Dr. Stoddard indicated, we will follow up with our EPI team just to get more recent data to see if there's any cross-referencing for data points to demonstrate the efficacy.
Thank you very much. All right. We've got Councilmember Friedson, followed by Councilmember Navarro, then Councilmember Reamer, then Councilmember Jawando, and Councilmember Rice. And we are going to try to get through this before we break for the recess in between. And this won't be our only opportunity to ask questions. So I just respectfully ask that my colleagues have targeted questions if they can. Councilmember Friedson.
Thank you very much. Appreciate this conversation. Appreciate the process that we have laid out to start today. Have stakeholders next week in a public hearing, and then to take this up. It's a very sober and serious conversation that we need to have. I'll just start by saying none of this conversation is a question of whether or not vaccines work, because undeniably vaccines work. It's a question of whether this is the best tool. And whether, as proposed, it is an appropriate tool in order to remove the needle in a sufficient way, and what the cost-benefit analysis is, which I think is a very different conversation. I think it's important to say that from the outset. I don't think any of my questions or anybody's questions from this body, based on all the conversations that we've had earlier today and otherwise, are in any way intended to question the efficacy of the vaccines, which are undeniable. So that just from the outset. We were asked to send detailed questions in advance of today's conversations. I sent personally a dozen detailed questions. I was just wondering if the executive branch has had an opportunity to review those, and whether we would be receiving responses to those questions in writing, and at what point.
Yeah, so we had a review session. We've actually had a couple of review sessions and we've actually got a team working on answering the questions. So we have answers to many of the questions and can provide answers to all the questions in writing. Some of them obviously had some research associated with around the cost benefit analysis and things like that. That's based largely on what other jurisdictions have done. So some of the ones that required more research aren't finished yet, but we can certainly look to provide those by the end of this week.
Okay, appreciate that. You mentioned, speaking of extensive research that was done in drafting this and then determining whether or not this was an appropriate strategy. Do we have access to that research? Can you share that with the council and with the public?
Yeah, we could pull together some of the research findings that we had. I mean, many of them were, we didn't produce like a white paper based on the research. It was, often bringing data to meetings and that kind of conversation. But we certainly could pull up many of those data points to provide as part of, I think actually some of the questions that were asked referred to the data itself. So I think they would be included in the answers to that questions.
Appreciate it. I just think it's important if the Board of Health is going to determine whether or not this is an appropriate path to move forward, that we have access to the same research that the executive branch used to determine it. Similarly, with the stakeholders, you noted meetings with stakeholder groups. We've heard from a lot of stakeholder groups that didn't feel like they had been consulted or given a heads up about this. And so if you could provide us with the specific details of who was included in what meetings, when those meetings took place, and the result of those meetings with stakeholder groups, private organizations who are impacted by this, that would be helpful as well. Okay, just a couple or a few questions that I have. There's clearly evidence to suggest that one dose of the vaccine improves outcomes, not nearly to the extent that you have determined is sufficient at this point. I would agree with you on that. Is there evidence to suggest that one dose of the vaccine more than 6 months ago limits the spread to others?
So the data, that's a complicated answer. So if you've had a dose of vaccine, you are less likely to contract by some percentage. And if you're less likely to contract, you are less likely to contribute to community spread. Now, If you have coronavirus and you've been previously vaccinated, the data suggests that you are probably as capable or nearly as capable of transmitting to others. But because of that difference in the ability to contract, if you took a pool of people who were totally unvaccinated, a pool of people who had one dose in it, you would see slower transmission within the pool of people with one dose than you would others, because you would see a reduction in their ability to contract and then put on to others. Obviously, it's a pyramid. So you start with one person infected and you go down the pyramid to more people infected. If one of those people in that chain is that partially or fully unboosted, vaccinated, that will reduce the probability that they contract and therefore spread to people below them on that chain.
Okay. Why were employees specifically excluded in the covered businesses? Could you just explain from a public health perspective how residents are unsafe in an environment if they're unvaccinated, but would be safe if the patrons are at least one dose vaccinated, but the employees, perhaps aren't? Could you just explain the public health determination that made that decision?
Sure. So, Dr. Bridges, I'll let Dr. Bridges speak. You want to?
Sure, Councilmember Friesen, thank you for that. So in any setting, be it this particular proposed regulation or any settings, we know that effective mask wearing is efficacious. And so that was some of the consideration that we took into that those employees would continuously wear a mask while others are unmasked. And so we've looked at additional data regarding the efficacy of that and what the other jurisdictions and or proposed or implemented vaccine passports described in that. And so we can provide additional data points regarding the efficacy of employees being wearing masks consistently and constantly and not being vaccinated.
Yeah, if you could explain that, that's a little bit challenging to understand, because if the mask itself is efficacious, then it would seem that we should be discussing a mask mandate that we discussed last week, not a vaccine passport.
Councilmember Friesen, I'm sorry. A restaurant is the one place where a guest cannot keep their mask on and do what they came there for. A staff member can keep their mask on during the process of doing the work that they're doing. So it's a very simple. It's the math. The process is very simple. I come to a restaurant, I have to take the mask off to eat, and that raises the risk of transmission and exposure. Versus wearing a mask as an employee is something I have to continue to do. The other piece of this is that employees are also consumers of service and restaurants in the county. So if they want to go somewhere else and have a meal and eat other way, this would also require that they have that passport in place as well for themselves. So that also would work to increase the number of folks who are perhaps getting vaccinated.
Appreciate it. Okay. As proposed, this has no end date. How long does the executive branch and the health team recommend that the passport requirement remain in place, and what are the specific objectives and metrics that would be used to determine whether or not it's effective?
So I think Dr. Bridges referred to this a little bit, to the contact tracing data that is provided to the state that looks at locations where this would be implemented, which are restaurant, not retail, recreation and gyms and fitness centers are all categories that you would expect to see reductions in the transmission in those places with the implementation of a vaccine passport. And so those would be the metrics that we would utilize, the COVID-linked Maryland Department of Health data that's provided to the counties that looks at contact tracing data for locations where people contract COVID-19. And so I think that we would look for, I think the overall sustainment of the regulation would be largely based on some community transmission metrics that that could be developed or would be similar to things that are otherwise in place for other orders, like even the mask mandate itself.
And just to add to Dr. Stoddard and to Dr. Crow, Councilmember Friesen, so in looking at those individuals who are patrons but who may be employees, we're also looking at data that clearly demonstrates that those individuals who vaccinated may have a lower viral load, especially those individuals continue to receive their boosters. So if in fact they're employees but they're patronize other establishment, that would add to the efficacy of having such a passport to mitigate any further risk or suppression of the virus. But we will provide data points regarding that and what the most current data and science are saying around vaccinated versus unvaccinated, as Dr. Stoddard indicated, in those business establishments or other places as proposed by the regulation.
Well, that information would be really helpful. I'd just say back in August, the county executive first began discussing, at least from my recollection, the potential for a vaccine passport. It could have been mid-July into August. It was around the same time that we talked about an employee vaccine mandate, and continue to have that conversation today, whether or not we're going to require of our own employees what the county executive is proposing that we require of patrons of private businesses. At that time, I suggested to the executive branch that rather than having a requirement legislated, that the county executive back in the summer, could have shown some real leadership, both regionally and with our private businesses, to create a portal, a vaccine passport, a voluntary opt-in vaccine passports for businesses, providing all of the back-end work that would be needed with technology that is available, would pay for it through county resources, would really make a push to private businesses for them to opt in, would have a branded effort throughout the county, and even invite other regional jurisdictions in that, into our vaccine passports to see if they'd want to join in as well, and provide those businesses with the tools, the resources to keep residents safe, to keep their customers and their employees safe, and do it as a positive, recognizing that we have this challenge that we are facing together, and we could bring stakeholders together in order to address it. So I am wondering what, if any, conversations took place back in the summer and into the fall to move forward with this on a voluntary basis, to talk to stakeholders, to determine with resources that at that point were available and continue to be available, what, if any, conversations or progress was made on that before this determination after DC moved forward to decide to propose this Board of Health regulation.
So one of the big things with the portal is that the state has thus far declined to allow portal systems to access the data for vaccinations. And so we would prefer that there be an online system other than the MyIR system. The governor's talked about adding a QR code to the MyIR system to allow this to happen, but so far it's not happened. But thus far, the state has declined to give access to the database for any web developer who wants to develop a vaccine passport utilizing the data. In fact, the conversation that we led actually led the Maryland Department of Health to say that some of the things that have been done with previous accessing of that system was inappropriate, and they were actually reviewing some of the previous things that have been done. And so obviously that sort of precluded that voluntary system. Now, obviously some restaurants have gone ahead and done it themselves. What we've heard in feedback, though, and I think Mr. Weissman, my colleague in the county executive's office, has been really meeting with businesses to talk about. One of the common points of feedback that we've heard is they have a hard time committing to doing this, knowing that their neighboring competitors, in most cases across the street, are not going to be doing it, and they're concerned that they're going to be driving business from one of their locations to the other. And they said they said they don't have. Some businesses said they didn't have an issue with this per se, but they didn't want to enact it unilaterally because of the impacts they would see in their micro environment of where they were implementing it. And so that was sort of one of the big considerations for the idea that, if we're going to do this, doing it, this is the same reason we, have decided that we shouldn't just trust people to do the mask requirement. We've said that there's going to be a mandate because it influences more than just the one person who decides to do it. And so that sort of gives you some background there around. We did try, and we would still be interested in developing an app, and we would develop an app, which up until this point the state has declined, and we have in writing their declination that they do not wish to have the data be accessed for this purpose.
Well, I want to be respectful of other colleagues who have, I'm sure, a number of questions here too. I have a lot more questions, or several questions that haven't been able to be answered, which I hope we'll get to, as you noted, by the end of the week. And I would really push for the implementation questions that I had and the technology that you intend to deploy. And just speaking to the response you just gave, honing in a little bit more and understanding how we lack the ability to have an opt-in system because the state won't allow us to have access through a portal to vaccination status, but we do have sufficient technology to have a requirement. I think that requires further understanding and
there is no technology that's required to have a requirement, though. You can have a vaccine card that you have, or you can take a picture of your vaccine card, or anyone can access the existing MyIR system to print out a copy of their vaccine record. And so there is no technology. The technology is supportive. It's not a requirement for any of these processes. And most of the places, for example, New York City's app is just you take a picture of your card, and that's their app. So
well, I guess my point is if the technology is available for requirement, it certainly was available, even without the state's cooperation, which is unfortunate. I would agree, but to have had an opt-in system at a time when we were trying to push more people to get vaccinated, which is one of the stated goals here in a place where we have 95%, according to the numbers you gave us earlier, of residents who have one dose or more. But I'll yield back to colleagues. I appreciate the thoughtfulness here, and we'll go through the legislative process and determine how best to move forward. Thank you.
Thank you. Councilmember Navarro.
Thank you. Actually, I wrote some questions, and Councilmember Friedson had pretty much asked my questions, but very interested in the notion of the criteria that we are utilizing for identifying which establishments. I would like to, definitely hear more about that. Also, the notion of the updated engagement with stakeholders. I heard Dr. Summers said that there have been conversations in the past, but obviously we're at a different time now in terms of our vaccination rates. But would like to know if there has been another effort to engage and to hear their feedback. Also the piece around what will qualify. So is it a photo on your phone? Is it going to be the actual physical card? That is something that I would like to understand. And then in addition to DC and New York City, would love to hear also what other jurisdictions similar to ours. I mean, it's pretty obvious that DC has a very vibrant restaurant and nightlife scene. New York City obviously does as well. We have some not at the same level. So just understanding jurisdiction like ours that tend to be more of a mix between, mostly residential, some activity centers, et cetera, but not full-blown city restaurant and nightlife scene, and to look at that data and see what actually we have been able to gather there. So those are some of just mostly logistics in nature, just to kind of understand how would this work, and what is the data that you have seen. That would be something that I would like to have once we get into the actual work session regarding this particular mandate.
Thank you, Councilmember Navarro. We will definitely make a note in the notes to follow up on that request. Councilmember Reamer.
Thank you so much. Appreciate many of the questions that were raised. Council President, you touched on an issue that I wanted to ask about the efficacy of the requirement. Given we know that true efficacy comes from boosters. Does the draft refer to full vaccination as defined by the CDC, or does it refer to specific numbers of doses? In other words, forgive me if you said this already, but if the CDC were to change the definition of fully vaccinated, would that translate through in this order? And then that's that is the requirement, or would we then be out of sync with that? Can you just talk about that issue, please?
Yeah, so right now it parallels exactly with DC, which is a 1-dose, 2-dose timeline. I think it is entirely appropriate, and I think the public health team would support the addition of a third timeline for a booster, or even utilizing the second timeline for all, for what we think would be a great idea. We largely parallel DC because of the desire, long-standing from the executive branch as well as the legislative branch to parallel our regional partners. But I do think that is an addition that would be a very worthwhile addition, because obviously part of the intent of any kind of vaccine passport is to encourage people to do the thing that you're requiring that they have done. then boosters are the thing that would, and obviously early childhood vaccination, all those things, that would certainly be the thing that would most notably. Now, I will tell you, boosters will be a little bit more difficult to implement because not everyone is eligible for a booster. So when you're reviewing a card or looking at a printout of a card, there will be a little bit more work that had to be done by the particular establishment to verify, is this person actually eligible according to their card for a booster, and is that reflected on their card? And so there are logistics associated with having a booster requirement, but from a public health perspective, it is certainly a worthwhile addition to have on there. Not currently reflected in the draft.
Sure. And just to add, Councilmember Reamer, so public health will continue to monitor the CDC guidance regarding their definition of fully vaccinated and boosters. And then if it's the council's will and this proposed regulation is adopted, continue as we've done with indoor mask mandates to make those recommendations per guidance or any policies or decisions that are made going forward. So we are prepared to make those necessary adjustments as we're doing now, absent of this regulation, but looking at those strategies to increase vaccination, as you indicated, in the county.
Thank you. Secondly, I would just like to issue an urgent plea that we remove the word passport from our lexicon here. Your average person hears the word passport and they think that there's some new document or maybe there's some new app, and there is not. This proposal is that you would show your card or a photo of your card. And, you don't have to become expert in some new technology and even if you do lose your card, you can always get a reprint of your status. So let's please, drop that word. It creates confusion instead of clarification. Just as an aside, my wife showed me her grandmother's vaccination card for polio from the 50s. Mm-hmm. It's been passed down. Amazing how, in some sense, similar it is. But so
Councilmember Reamer, just to add to that, that's a great personal story. I know that I looked at some data where individuals still had their passes for yellow fever. And so in some of the literature that I read from Yale, they used the term COVID passes.
Okay, well, I don't know. I think everyone is familiar with their vaccination card. And I think the idea that you have to show your card or a photo of your card is something that everybody can understand. And so I would just encourage us to try to keep within the bounds of what people already know. The state database is a backup. So you don't have to panic that if you lose your card, you're shut out. But next point I want to make, I just had the opportunity to spend a couple days in New York over the holidays. And, I had, as a result of that requirement there, I had to show my card, to eat in, and I dined in multiple restaurants in New York with my family, at a time when we also knew that COVID was peaking. And we're vaccinated and as boosted as we can be. And we felt confident that we could indeed do that. And the requirement, I think, frankly, improved our confidence a little bit that it might be more safe. I think we are generally confident in the vaccinations. And I think we should all be generally confident in the vaccinations. The data on your risk level once you're fully vaccinated is so overwhelming. It is just so utterly overwhelming how much safer you are, and frankly, how much safer you are than when you're unvaccinated. And then you can begin to really compare it to other risks that you confront in your daily life, and recognize that being vaccinated is the answer. And I can see how this proposal is part of that. It's part of stressing the importance of vaccination. That's fundamentally what it achieves. And I'm heartened to hear that there was an increase in the vaccination rate in New York after it was enacted, because I've wondered, frankly. There are some major kinks in this one. There's no question. I'm very concerned about the potential for businesses to have to deal with those claiming an exemption. That sounds very complicated, or any number of other issues. But there's a positive possibility here that in a community that is highly vaccinated, that believes in the vaccinations, that where yet many are not yet comfortable, coming fully out into the public, that it increases confidence and it leads to more normalization. That seems like a positive possibility from this proposal. So we will just need to weigh all of these carefully and give serious thought to how to approach this challenge. Thank you.
Thank you. Councilmember Rice, followed by Council Vice President Glass, and then Councilmember Katz. Councilmember Rice.
Thank you, Mr. Council President, and I'm going to try and be quick since a lot of the questions have already been asked, but let me just make sure that I understand. A person who is vaccinated and boosted sheds the virus at a smaller amount and for a shorter period of time. Is that not correct?
That's correct. Go ahead, Dr. Stoddard, based on the data that we're seeing, but there's also challenges with breakthrough cases.
Yeah,
absolutely.
So the data is a little softer, I would just say. You're certainly 5 times less likely to contract, but the data on transmission is not quite that significant. But if you have a vaccinated person in a room, you should feel a lot better about that person being in the room than the unvaccinated person, without question.
So I think that's again, just to kind of understand the spirit of what this is, we're trying to keep as many people safe as possible. So encouraging in a room where you're going to not have a mask on for a prolonged period of time, you want to try and reduce that likelihood of transmission as much as possible. And that's what this is truly about. So I just want to be very clear from that standpoint. I do have questions when it comes to, again, the quote unquote policing of vaccine cards in terms of what the demand is. Dr. Stoddard, I appreciate what you said, in that as long as a venue has a good faith effort, I would just, whatever we end up doing, I would just like to encourage and remind folks that regardless of whether there's a vaccine passport or vaccine card proof that's required for entry, does not mean that you should still let your guard down, that you still need to be mindful and still wear your mask and still continue to protect yourself as greatly as you possibly can, because just as we have heard, and I personally have seen, wearing a mask and being vaccinated and boosted does not mean that you will not contract the virus. So that is really important for our public to hear and understand. However, reducing the percentage and reducing the likelihood is also equally important. And so my question is along the lines of where our target audience should be. We've talked about restaurants, we've talked about some of our other entertainment establishments, but I want to be clear. Are we talking about houses of worship? Are we talking about what's the, and I know that's not listed in terms of what you sent over, but it is something that I think we need to be very clear about, and why we're targeting the certain places that we're looking at when it comes to the higher, what we perceive as higher risk, which means that we need to try and enact a higher level of protection or reduced level of exposure.
Yeah, so I'll start, and I think maybe Ms. Kinch may have some comments on this as well. I think that obviously we've largely aimed to parallel, and if you look at those 8 organizations that are entities that are covered across all the programs that are similar to this across the country, they all are targeted towards the same businesses. They're largely the businesses that you see at the top end of the contact tracing data platform, that also happen to intersect with places where face coverings are either more difficult to wear, as in the case in fitness centers, or not worn by practice, like a theater where you're consuming food, a restaurant where you're consuming food, etc. And so those were
Dr.
largely.
Stoddard, can I just stop you there, because I think that's a very important point. So you said at the top of contact tracing, and also when it comes to where we see face coverings that may not be worn as much of the time that the person's in that establishment.
Correct. That's sort of the basis for what universally these programs have. That's why they look so similar in terms of the types of establishments that are covered, and frankly, largely the houses of worship, for example. I think people have generally wanted to give deference around free practice of faith. That there's been less willingness to go down that road, legal and otherwise, for less public health reasons than other reasons. So I want to be clear about that. So there are a number of enumerated locations in the proposed bill, regulation, I should say, that are enumerated that this would not cover. And certainly that list that's certainly an area where I think some more definition would be appreciated. We actually added more definition from what the district has put out there based on the feedback they got from when they announced theirs. And so, but there's probably more opportunities for clarification around who it should apply to and who it shouldn't. But from a public health perspective, obviously, if you see more contact tracing data that supports it, and it's a location that face coverings are less worn and more difficult to wear in that setting, that's largely the businesses or sectors or environments where you see in the proposed program.
And if I can comment a little also on this issue, also, Councilmember Rice, what I would note that given that the purpose of this is to encourage additional vaccinations, we did have to be concerned with ensuring that our residents are still able to access essential county services, as well as to exercise their constitutional rights to petition government, as well as seek your essential services, which is why in part you see that there are exceptions for public libraries, rental assistance, food assistance, etc. So that's part of the rationale for the exclusion of houses of worship, pharmacies for medical care, and certain other areas.
Well, no, I really just want to say thank you, and I think that those points are important as we look to continue the discussion around whether or not we move forward with something like this. I think that the primary goal in terms of what we're trying to achieve and why we're strategically looking at these places helps to guide us in this decision. So thank you very much. Back to you, Mr. President.
Thank you. And I'll just go back to Councilmember Reamer's point about eliminating, I'm not going to say the word, but how we refer to this order is important. And he's right, because that has been a lot of the questions about how that would work. Just, is there some new technology being implemented? There is not, and it's important to note that. Council Vice President Glass, followed by Council Member Katz. And let's, if we can, everybody, I apologize, try to wrap up. We still have to get through consent calendar and break for recess. Council Vice President Glass.
Sure. I will be brief, Mr. President, because our colleagues have asked the questions I had listed regarding the rationale and the mechanics for this proposal. But this proposal, similar to all the other measures that we have taken and are contemplating taking, reflect on the regional approach that we've adopted over the last 2 years, whether it is the mask mandate that we adopted last week with the potential sunset for the end of the month. And as it has been referenced multiple times during this conversation, the fact that DC has a vaccination requirement for most of their public places. But I had seen in media reports that the mayor of Baltimore has discussed the idea of a regional vaccine mandate for the large 8 counties in Maryland. And I'm curious what our participation has been, if those conversations have taken place, and what the executive team's thoughts are on a regional approach within the state of Maryland for this proposal.
So thank you for that question, series of questions, Council Vice President Glass. We've actually had conversations with the other jurisdictions and the other health officers with the Maryland Association of County Health Officers have also looked at vaccine cards, vaccination statuses, or however we identify it and named it, but also indoor mask mandates. And so we're looking at that now. We've created a matrix to identify those jurisdictions, to create a regional snapshot, because as I indicated in my opening remarks, we know that folks travel, folks often have similar policies and or regulations in place. And I will be following up with Dr. DeRaza, Baltimore City's health officer, after this call sometime later today to talk about the very things that we're talking about this morning. And so thank you for those comments. It's very fortuitous, and we are having those conversations. I think Dr. Snyder was going to add to that.
No, I was just going to say that obviously some of these decisions are both public health driven and also based on other factors, logistics, politics, what have you. So obviously having the conversation regionally, we 100% agree, and which is is why we didn't propose this earlier, frankly, is that we wanted to see more on board. DC came on board, and it sort of made more sense to really broach this conversation in Montgomery County. But I think we'd obviously support, and we'll work, as Dr. Bridges alluded to, we'll work with our neighboring jurisdictions to see what we can get done regionally, and to the extent necessary, we would suggest paralleling what the region does. Should other jurisdictions show a willingness to really step up and do it. But it comes down to not just the public health guidance on what's safest and what's best, but also, there's some other factors that are being looked at.
Sure. Well, my simple request is to keep us updated on those conversations, getting the pulse of our colleagues throughout the state, because again, we all have shown a willingness to band together to protect our residents in the region. And for this particular proposal, I think we need to have eyes wide open, and we need to have the pulse of the region, not just Washington, D.C., the District of Columbia. So please do keep us updated, and I yield back, Mr. President. Thank you.
Thank you, Council Vice President Glass. Councilmember Katz.
Thank you very much, Mr. President. I too will try to be brief. Councilmember Rice did hit on much of the first question that I had is about how you decided on who would be on the actual list that would be covered by this and who would not. And I understand some of the logic, but if the logic is that the only way you could do something is to remove your mask, I understand that part. If the only way you could eat is to remove your mask, if the only way you could, do whatever, you have to remove your mask, go to a hookah bar. But if you're in a bowling alley and aren't you still required to keep your mask on if you're bowling? How does that work?
So a couple things generally bowling falls underneath recreation, and most recreation places you can consume food and drinks. Now, obviously, if a place, maybe I'm spitballing here, but if a place didn't have consumption of food and drink while they were playing bowl, when I go bowling, I am typically consuming something. I'll say soda and pizza, but so it depends on the way the environment is set up to operate. But also, we brought this up for fitness centers, because that was another question we had. Is we've seen. I can't tell you how many compliance issues we've seen with face coverings in fitness centers. They are very difficult to wear. As we all know, during physical strenuous activity, it's very difficult. I'm not saying bowling is the same way, but the way your body is moving, mask wearing is not great when you're playing a sport like bowling. And so, some of those things were considered. Now, if the council were inclined as the Board of Health to have allowances for places that did not serve food and drinks during some of those activities, I think carve-outs would be okay. But I think generally speaking, we've been inclusive because we know that those environments are not uniform, and many of them do have consumption of alcohol, food, and other things that would make them riskier environments.
And I appreciate that. And I understand if someone is eating and drinking, then they would be under the same rules if someone is eating and drinking in a restaurant. So I think that's one of the areas that we should be discussing. And the only other thing I ask is that if a person is exempt, do they get a card that says they're exempt?
No, not typically. But I will tell you on the exemption, because that was one of the questions that was asked by the Restaurant Association when we came forward. And New York City has put out very good guidance that the restaurants are effectively utilizing right now, because they've been doing this the longest, that obviously we would parallel, should the Board of Health pass this regulation, there would be a parallel set of guidelines that we would develop based on the bill that would clarify some of the language around what the expectation for judging a medical or a religious exemption and what an accommodation looks like. Because I think people often say, I have a medical or religious exemption to any mask wearing. I mean, you can have someone who suggests that too. But a reasonable accommodation does not mean you travel and move throughout the establishment unfettered. In all cases, if there's an accommodation that can be made that protects the public and your rights as a person who is disabled, that is what a reasonable accommodation is all about. I'm sure Ms. Kinch could give in more clarity on that, but to be clear, it's not necessarily you say, I have a medical exemption, I can go into the establishment as if anyone else could, or I have a religious exemption, I can, there can be accommodations that are made for those specific examples that vary based on the kind of facility or activity that's being offered.
Councilmember Katz, if you wanted me to add to that, I would just note that the tools that each business should use in terms of enforcing this are the same tools that they would use when there is a person asking to not wear a mask when they enter their establishment. So once a person identifies that I am unable to, either present proof of vaccination or to wear a mask because I have X condition or this is my religious belief, for instance, then the establishment is supposed to engage in a conversation with that person to see if they can reach a reasonable accommodation to determine how they can best access those services. So for some people, it may be for the vaccination pass, it would be, okay, you can wear your mask and come in for a limited period of time. Maybe you can't eat inside, but we can set up a table outside. Maybe you will be doing carry out. And really it's up to the business and the individual to work through if there is something. And if there isn't, or it would be unduly burdensome, for instance, a movie theater is not going to stream, movies so that a person can watch them at home without wearing a mask, then that would be unduly burdensome and the accommodation wouldn't be available. But it is the same tools. It's just a little bit of a different conversation based upon this particular requirement if it were to pass.
Well, I do believe that this needs to be another part of this conversation, is the burden that we are putting on the person who's standing at the door who says you are or are not allowed to come in, and how they could handle somebody saying, look, I'm exempt. Well, there's no proof whether they are or they aren't. And so that becomes a whole another issue for this. As much as everybody wants everything to be as safe as we can possibly have it, are we being as safe for that person standing there who says you can or can't come in to this business today? So anyhow, I yield back, Council President. I do believe that we have a lot of answers that we need. And if I could ask, if any of the answers that you're sending back to any individual council member, if you could copy all of us, the public as well, obviously, so that we could all be aware of all the answers that are given, that would be appreciated. Thank you very much, Mr. President.
Thank you, Councilmember Katz. All right, this has been a good conversation. That was a good segue, Councilmember Katz, because the next work session we will have will be to interact with and talk to the stakeholders who are going to be most impacted by this and have to enforce it. So Councilmember Friedson and I were texting each other back and forth as we're wrapping up. You don't need to provide an answer now, but I guess there is just a general question about what the ultimate goal is. I know there are multiple goals, but is it increasing vaccination rates? Is it limiting spread? It doesn't sound like it's a clear and concise answer, which I understand. But in the next work session and discussion, if we can be prepared to just articulate that, and most importantly, articulate that to our public, I think that would be helpful, because that will dictate the metrics that we use to determine whether or not this was successful, if it is in fact enacted.